Hi, welcome to another Tuesday Tips. And today we're going to be talking about your aging parents, how to keep them possibly safer longer in your home, and also to possibly improve their strength, improve their balance, and also help to reduce falls. And that is the use of physical and occupational therapy. And I don't know if a lot of people understand that when you use home physical therapy or home occupational therapy, those are covered services under the home health benefit for Medicare. So even if you have a Medicare Advantage plan, they also cover home health for physical therapy, occupational therapy, speech therapy, nursing, home health. There's several things that you can do. And on our YouTube channel, we do have a video that talks about therapy, and we have a blog post. But today I wanted to focus on physical therapy and occupational therapy. And what's the difference? Physical therapy works on the bigger muscles, walking, balance, and occupational therapy works on like the smaller muscles, the things that you need to do to perform your activities of daily living, getting dressed, washing up, taking a shower, cooking, cleaning. So occupational therapy works for with those muscles. So physical therapy, if your aging parent is maybe tripping, you're concerned about falls, their balance may need, is off. You think that they're kind of staggering at times, or they're getting up and they're dizzy. Good idea to have a physical therapist. You would call your doctor, explain the situation, and ask them if the doctor feels it would be appropriate to get a physical therapist in the home. The therapist does have to have a doctor's order to be able to go into your home. If you are a Medicare patient, which you need to be homebound, which means it's a difficult or taxing effort for that loved one to leave the home unassisted. They can go outside and walk around the block. They're probably not homebound. So in that case, home physical therapy may not be appropriate, but what would be appropriate in that instance would be outpatient physical therapy, because it's a little bit easier for them to get out, but they still may have some issues. A lot of times, the crystals in your ears, they're in a pattern, and if they get out of whack, that can cause vertigo and dizziness. And physical therapists, those are the ones that correct that and have exercises and do to get them back into the right spot, so the balance and the vertigo and the dizziness goes away. Occupational therapy, they're very good for coming in and doing a home safety eval. And what's that? Well, a home safety eval comes in, looks at your bathroom setup, looks at how you can get from one end of the house to the other. They work on both physical therapy, occupational therapy, work on energy conservation. So if your loved one has chronic obstructive lung disease, COPD, asthma, lung cancer, things like that they get short of breath when they're walking. Well, the therapist can work on energy conservation. And maybe it's a matter of determining when they get short of breath. You put a chair in a certain area, or sometimes they even go to the extent of putting a sign on the wall saying, rest here, or stop here, take a break here. There are so many things that they can do for you in the home. Again, all of the therapy would need a doctor's order. And then the doctor's office would contact a home care agency, or if you have a home care agency, we do have that checklist right in the file section here on the form, 20 questions to ask your home health agency. So you can choose your own. It is a regulation that you have a choice. They can't just say, okay, we use this home care agency, this is the one you're going to use. No, they can't do that. They have to give you a list, and you can and you have a say so, and you can choose what home health agency that you can use. So that's really, really important, because you do have a say so in that. A lot of times they'll send a nurse in just to maybe do the assessment and see if there are any nursing needs that go along with the therapy. They may they'll review medications, make sure there hasn't been changes there. So don't be surprised if possibly the nurse that does the assessment admits you to home care may check with the doctor and say, hey, we noticed a few things. Can we work on this? So, it's all these healthcare providers coming to the home, and it's intermittent, which means they'll come 2 or 3 times a week. A lot of times, they'll stagger their visits. So OT may come on one day, nursing may come on another day, PT may come on another day. So you're getting more services in a row. Or if you like them all in one day, you can request it, but sometimes it might be a little taxing for you to have all your therapies in one day. And then usually, typically, home therapy or nursing lasts maybe anywhere from 2 to 6 weeks, depending on what's going on. Say, for example, if your loved one has a knee surgery, they have a knee replacement, and they have a lot of comorbidities. Maybe they have a lot of illnesses, a lot of chronic disease that's going on, makes them a little weaker, makes them a candidate for maybe not progressing as quickly as someone else that's having that knee surgery. Well, then home physical therapy may be a good option to come in and work with you, because on those knees, if those knees don't get working and get that flexion and that they get stiff, and then it's very difficult. You could lose function of that knee. So you've got to get with those knee replacements, you've got to get those knees working right away. So sometimes home therapy can come in and keep you going with some home exercises and work that knee until you're well enough to get into, or you're strong enough to get into a outpatient physical therapy program where they can do some more extensive work. There's only so much they can do at home because they don't have a lot of equipment. They do have more equipment in the hospital, in the outpatient physical therapy or therapy room. So the goal is sometimes they need more therapy than what they can do at home, but the home therapists will get you as far as they can go. And if you still need more, then they would recommend outpatient therapy at that time. Now, with occupational therapy, they also work with cognitive issues. They work with memory. They work with trying to get you in a routine to keep you safe at home. They work well with dementia clients as well, or patients or your loved ones. And so occupational therapy also works with mentation or mind or cognition. So lots of things that people maybe don't realize that occupational therapy and physical therapy work with. But yes, that home safety valve is huge. And a lot of times it's a combination of physical therapy and occupational therapy, looking at how many steps your loved one has to go into, how to negotiate those steps safely. What kind of equipment needs to be used? Do they need a walker? What kind of walker? A standard walker, a rolling walker, a hemi walker? What kind of cane? A single point cane, a quad cane? There's so many different things that I know you don't understand what a lot of those meanings are, but that's the importance of having therapy come in, because they can determine exactly what type of equipment is best for you based on your deficits or what you need help on. So just borrowing Aunt Sarah's walker may not be the best thing in the world, because number one, it may not be sized for you, and it may not be the right one. A lot of times with Parkinson's or shuffling gaits, the standard walker is not good, because it can run away with you and you could actually fall. People have to have, with the rolling walkers with the seats on them, people have to be able to have the cognition to be able to understand that when they stop or want to sit down, they have to put the brakes on. Otherwise, they go to sit down and the walker goes out from underneath them and they fall. So lots and lots and lots of good reasons why you shouldn't take a lot of these measures in your own hands, and let the experts work with you so that you can get the best professional advice again. And the goal is to keep your aging parents keep them home for as long and as safe as possible. And so again, don't hesitate to contact the doctor and see if physical therapy or occupational therapy may be right for you. And you know what? And if you don't know, it can't hurt, because the home healthcare agency, they will come out, and the first visit is they do an evaluation, they do an assessment, and they will determine if they can and cannot help you. So having them come out doesn't necessarily mean you have to have them, or need them, but it's a good just to see if there are some needs that they can help with. So that's the end of this Tuesday's tips, and we'll see you back here for the next one. Take care and have a great day.